Thank you very much, Mr. Speaker. My question is to the Premier. Last Friday, we got word in the region of Waterloo that their public health unit was to be merged with Peel and Halton regions, as well as Wellington and Dufferin and Guelph. This new public health unit will serve nearly 3 million people with very different needs over a large geographic area. Couple this with millions of dollars in cuts, people and medical officers are justifiably worried. Why? Because there will be less money to serve more people, and there is no evidence to suggest that the government understands the consequences of their cuts and of this move. Mr. Speaker, why is this government not thinking before they act?
Questions to the Premier.
Minister of Health.
Minister of Health and Long-Term Care.
Thank you very much, Speaker. We are modernizing our public health system so that it's going to be able to respond to the needs of Ontarians now and into the future. The document that the member was referring to is a consultation document. No boundaries have been decided upon yet. That is subject to consultations with the local health units as well as with the municipalities, just for purposes of discussion to understand what the appropriate boundaries should be. So there's nothing carved in stone as yet, and I think that that will become clear as we have those discussions and as we speak with municipalities and the public health units. So there's no need to push the panic button.
Supplementary question.
And yet, the Peterborough medical officer says that there was no consultation about the proposed boundaries of the new public health agencies, and they said we've not even been given any rationale for why the regions look the way they do. Mr. Speaker, public health works because it prevents the spread of disease and other negative health outcomes. For every $1 spent on immunizations, there are $45 worth of savings to the healthcare system. These are smart investments in the healthcare system. And at a time when hospitals are overcrowded, we have a record number of people dying from opioid overdoses, and measles cases have been reported in Toronto. These public health cuts are frankly irresponsible. Public health officers and medical experts are telling the government this. Why are you not listening?
Remind the members to make their comments through the chair and recognize the minister again to reply.
Thank you. Thank you, Speaker. Well, in fact, consultations are happening through technical tables that have been established. There will be consultation with the local health units. There will be consultation with the municipalities about the appropriate boundaries to make sure that the needs of Ontarians are going to be met. And I am confident that with the monies that the local health units and the broader, bigger health units as they're established are going to receive, they will be able to meet the public health needs of their communities, making sure that people receive the vaccinations that they need, making sure that the children's and other breakfast and lunch programs are continued, making sure that the people with special needs are being met. All of those things can and will be accomplished if people set their minds to the priorities of what public health units are set up for. We were established to be financial stewards of public funds provincially. We take that seriously, and we know that the public health units will do the same to make sure that those priorities are covered.